Hi teacher, my name is Alexander Salazar. I'm a student of 14003 group and I'm going to talk about coronavirus and quarantine. Coronaviruses is a wide family of viruses found in both humans and animals. Some infect humans and are known to cause various disease, it from common cold to more serious illnesses such as MERS and SARS. SARS-CoV-2 as a new coronavirus identified. This is responsible of caused COVID-19 that started in Wuhan, China, in late 2019 and has spread throughout the world. The first case of COVID-19 were related into a live animal market in Wuhan, uh, suggesting 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 the virus was initially transmitted to to animal from animal to a person or to human. The person-to-person spread occurs through contact with an infected secretions. Primary throat occurs with a large respiratory um, respiratory drops, but cold also occur through contact with a surface contaminated by respiratory drops. For this reason, we can stay in our home. We call this quarantine. Effects of quarantine. The emotional health of many people is affected because we don't have a physical contact with our friends. People in quarantine are more to exhaustions, detachment from others, anxiety, anger, and another indicators to acute and another indicators relate to acute stress. Being quarantined means that we don't do physical exercises, and that significantly affects in our health. Um, it is it it is very important to try to build routines that as a healthy people's economic is also affected because there is no mobilization and old businesses are closed without obtaining any income. Education is also affected because we have virtual classes and it isn't the same to face-to-face classes. This lowers the level of education. Basic to protections measures. Wash your hands with a soap and water, and after that we should use and an alcohol-based hand sanitizer. The yep. This kills the virus if it is on your hand. When coughing or sneezing, cover your nose and your mouth with your elbow flexed. Yep. We can use a mask. This prevents to spread germs of a virus and a virus. Hmm. Keep keep at uh, keep at a 1 meter from keep a 1 meter away from you and others, particularly those who cough, sneezes, and have a fever. It is too close, you can inhalate the virus. avoid avoid touching your eyes, nose, and your mouth, um, because the hands touch your the hands touch many surface that may be contaminated with the virus. If you touch your eyes, your nose, and your mouth with your hands, um, with your hands, you contaminated from surface to your head. We can use glasses protection glasses, and protection gloves. If you have a fever, cold, and shortness of breath, get medical attention early. Conclusion: if you respect and obey, if you respect and obey all the regulations issued by the government and take into account the recommendations that were present, you don't have to worry. Thanks, and remember, stay at home.